Job one for every Long Island high school parent, coach, and trainer is to avoid student injuries. But if those injuries come, it may be time for more than just a Band-Aid fix. Carol is outside our studio with our back-to-school preps and a look at the reality of sports injuries and a new approach on concussions.
All right, we want to avoid injuries, but if they happen, and yes, they sometimes do, I'm here with Dr. Steve D'Souza of East Northport Physical Therapy. You are the physical trainers for St. Anthony's High School. How do you recognize an injury?
Well, I mean, obviously, we always look for things like bruising or deformity, swelling in a joint.
And you say, man, kids, don't play through it. Talk to the trainer, talk to your parents, because you don't want to re-injure. Also, equipment is very important. I know you say that the shoes, the cleats, they have to fit right and be even.
Yeah, well, you always want to look and see and ensure that there's not some sort of uneven wear. That can lead to sprained ankles, a foot sprain. You want to make sure that shin guards fit properly.
They should go up to the knee, not lower, not higher. All right, and Ed Modica, who is the head athletic trainer at St. Anthony's, it has to fit right, a helmet.
Absolutely. I mean, anytime you put any kind of protective equipment on, it should feel nice and snug. Okay, so we can look at Mark right here. If I take his helmet and move it back and forth, you see that it kind of moves around and loosens up. Now we go to Ed right here, and once we grab onto his helmet, look at how it kind of stays with him. It's nice and snug. You can see the jaw pads are nice and flush, the cheekbones, and the chin strap is nice and centered.
All right, and folks, listen, this year there is a new concussion standard for New York State schools. Every school, public school, has to have a program for concussions, testing the concussions. In fact, I took the test. You had me take that impact test. And a student who is hurt is actually tested a couple of days later?
Yeah, usually what the impact test recommends is that the student is tested somewhere between 3 and 5 days after they begin to recover from the concussion itself.
All right, and if you can do those memory and those color tests and all that again, it means you're okay. If not, not so much. We've got much more information about all of this. Go to our website, news12.com. We're going to connect you to East Northport Physical Therapy, and we want you kids to have a very safe season.